Assalamu alaikum everyone. Hello and welcome to Happy Eyes Pod, your number one African eye care podcast where we explore the world of eye care one blink at a time. I'm your host Dr. Amal, optometrist by profession, educator by passion, and your guide on this journey to clearer vision and smarter eye care. Hello Happy Eyes crew. This week, I'm bringing you a roundtable chat with some amazing eye care professionals, packed with insights, inspiration, and all the industry buzz from the Eyeball Summit. Yes, that's really what it is called. Now, I wasn't physically there, but mentally I had a front row seat. You know, that kind of thing. Luckily, a few of my brilliant colleagues were there in person, and they're here to spill the tea on everything they saw, learned, and heard. Think of this as your backstage pass to what's new, what's changing, and what's inspiring us most in the ever-evolving world of eye care. So let's
Okay.
kick things off with quick intros so that our listeners know who's at the table today. Just tell us your name, your role in eye care, and what excited you most about attending the Eyeball Summit. We'll start with you, Dr. Bernal.
All right. My name is Dr. Abdurrahman Abdul Qadir. I'm an optometrist working with Osman Dampodio Teaching Hospital, Sokoto. What excites me to be in the Eyeball Summit, this is the first of its kind. It's an Eyeball Summit organized by Optometrists and Dispensing Opticians Registration Board of Nigeria. The Eyeball Summit is organized in order to bring all cadres of eye care in Nigeria, ranging from ophthalmologists, optometrists, opticians, ophthalmic nurses, to come together and discuss innovation in eye care, to discuss ways of improving quality eye care services, and also to discuss about leadership in eye care, and also to discuss about way forward to resolve conflicts in eye care so that uh, it will no longer be a biased professionalism, but a patient-centered professionalism, whereby everybody is looking at the patient. That's the benefit of the patient, not individual benefits.
Hmm.
The program actually is well organized. The board have a lot of people on ground to put things in place with a lot of uh, panel discussion, a lot of keynote speakers, uh, vice chancellors, CMDs, and a lot of dignitaries from the House of Assembly,
Government
senators,
officials, right?
a lot.
Yes.
The gathering actually was indeed wonderful and a lot of fun and a lot of educative and interactive sessions.
What stood out in what you just said in the brief intro you gave was that the Eyeball Summit was actually for all eye care professionals. Most of us thought it was just for optometrists, but it's actually interesting to know that it had ophthalmologists, ophthalmic nurses, and opticians also in attendance.
Yes, of course.
So at least different perspectives. Okay, so now
Yes.
Dr. Galadima, can you give us a brief intro? Like tell us your role in eye care and what excited you most about attending the Eyeball Summit.
Okay. Um, Good evening, everyone. My name is, I hope you can hear me.
Loud and clear.
My name is Dr. Usman Bello Galadima. I'm in public service working with Usman Danfodio University Teaching Hospital, Sokoto. And to be honest, I think the most exciting thing about this year's Eyeball Summit, which is actually the first of its kind, organized by the Optometrists and Dispensing Opticians Registration Board of Nigeria, was the way, all the eye care team was brought together, having a truthful discussion about the most important subject, our profession, our care given, which is the patient. The ophthalmologist have their representatives, the dispensing opticians, the ophthalmic nurses, and also the stakeholders, and also the optometrist. The theme of this year's Eye Ball Summit was shaping the future of eye care in Nigeria, strengthening systems through strategic alliances. And in reality, they did not detour from the subject
That's very
because
interesting because sometimes, they just go off key and you leave the theme and you
yeah,
just go.
exactly. So it's interestingly they stood with the subject and were able to discuss mainly about the provision of quality eye care service or eye care service delivery system in Nigeria, which we all know includes both the optometrists, the opticians, the ophthalmic nurses, and also the ophthalmologist. Our
Okay.
limits, individual limitation, and also where each of us comes in. And another thing was the stakeholders, the way all the dignitaries were invited to give their own feedbacks and also contributions to seeing that a good and quality eye care service is being delivered to patients across Nigeria. So I think, yeah, that's what excites me more,
Okay.
seeing a team entirely, moving forward to see that we have given our share in treating our patients.
Okay. So let's start with you now. What was your most outstanding moment? What session or speaker really stood out to you and why?
Okay. As I said, there were some panel sessions. Like the
Okay.
first one was between an ophthalmologist, an optometrist, an ophthalmic nurse, and also an optician.
So everyone was
Each one,
represented.
yes, each one with
Perfect.
a moderator. Right,
Yes.
exactly. Each one was, and I think to me that is the most iconic moment. People will just, go around beating the bush, like giving, like saying, maybe you guys are to be blamed for this, you guys. But
Mm,
right then is when I realized that, we all know our limitations. We all know the scope of our practices. It's just that sometimes, I guess one way or the other,
we get
some of us
carried
don't
away.
follow through.
Yes.
Yes, because everyone was talking truthful, like making a lot of sense. The optometrists, even the ophthalmic nurse, even the opticians, everyone was, talking about, yeah, this is how it should be. And the most important thing where the confusion normally comes in was in eye care delivery system, who is the first point of
Call.
contact
Yes,
in
yes,
clinic?
yes.
Yes, and this brings about a lot of confusion. You see referral from optician to optometrist, or from optometrist to ophthalmologist.
It
Yes,
just goes
and
anyway.
exactly. And while they were discussing about it, everyone was like, "Yes, the referral can go both ways because it can start from because normally we have the delivery systems. We have primary institutions, healthcare, we have secondary healthcare systems, and we have tertiary. But especially here in the northern part of Nigeria, most of us tend to move straight
To
directly to
tertiary.
tertiary institutions.
Yes,
Yes.
yes.
So in tertiary settings, the way the delivery system is different from what you see in primary, I guess, primary health settings and also secondary health settings.
Secondary, yes.
Exactly, because in
But
primary health
don't you
settings,
think another challenge could be that in most primary eye care settings, there's shortage of optometrists. So when you walk into the clinic with, let's say, acute conjunctivitis, you're more likely to be seen by an ophthalmic nurse or even an optician, maybe, than an optometrist.
exactly. So that was tabled out.
Yes.
Like, okay, just because, for example, now in primary healthcare setting, you are most likely to, as you said, meet maybe an optician or an ophthalmic nurse. So in that setting, in that particular setting, the point of contact would be that ophthalmic nurse or the optician. But him knowing his limitations and scope of practice will make him now treat what he can and also do a
Refer
proper
appropriately.
referral.
Yes.
Yes. But
Okay.
when you go straight, like you say, allergic conjunctivitis, you now move straight to tertiary institutions. The tertiary institutions have their own way of delivery systems. Maybe the first point of contact there is an ophthalmic nurse will do visual acuity, and then you'll be sent to ophthalmologist direct,
Directly,
and
yes.
then maybe back
Because
to an optometrist.
the expectation is that anyone coming to
Is
a tertiary health
based
institution
on
is
referral.
exactly is coming for serious problems, for chronic
Yes,
eye
yes.
diseases. You're coming for retinal detachment, or you're coming for
Ehem.
diabetic retinopathy or severe glaucoma that probably needs surgery. So you're most likely to be treated by
Yes,
an ophthalmologist.
exactly.
So that's the logic there. Okay,
Exactly. So
amazing.
I don't see, yes, I don't see, this is where we are having the confusion,
Yes, there's an
because
overlap.
yeah. But because our people, lack of awareness and all,
Yes.
and
And
because
that's why we
most
need more of these kind of events.
the
Yes, like the
events,
eyeball summit. Yes.
exactly. That way you can be able to, understand and not start pointing fingers like
Fingers.
who the
Yes.
hell is the
Yes.
one that did and that.
Perfect.
Yes.
So now over to you, Dr. Abdurrahman.
Okay, Doc.
Was there any moment in the summit that made you think, this will change the way I practice? Any wow
Yes,
moment?
of course, Doc.
Okay.
Because as I said, there was a panel discussion, and also there was a keynote speaker, a vice chancellor from Imo State University that presented, uh, who was the keynote speaker in the event. He actually uh, talk more of awareness that we are lacking, especially in optometry cadre. Many people don't know about optometry, and he even cited an example how he, as a BC, is even convincing students to go for optometry.
Of course. Wow.
Yeah, and
Is he an optometrist too?
I, no, he's not an optometrist at all.
This is interesting.
He didn't build his cadre, but he's neither an optometrist nor a medical doctor. But he's the one convincing people to go for optometry, and that's actually tells me a lot that we are lacking a lot of awareness. There is a very big gap that is needed to be filled in this profession. That's optometry. To his even surprise that many people are even choosing nursing over optometry.
Optometry.
To him, he has a lot of awareness that why will people be so excited that they want to go for nursing?
Instead
Why
of
not go for
optometry, yes.
that? Nursing is having more and much awareness that everybody that comes up is either medicine or nursing.
Yes.
So actually, his presentation wakes up, give us a sort of encouragement that we need to wake up and we need to do more. We need to do a lot of advocacy, a lot of awareness
Yes.
for
Especially
this,
in northern Nigeria. And we need to motivate the
especially.
younger ones, give career talks in secondary schools and all of that, even primary schools.
Of course, Doc. And also, there was a final discussion on innovation in optometry. It discussed about the entrepreneurship opportunities in eye care. Actually, we've learned a lot, and we come to realize that the eye care industry is very vast, and uh, we have uh, a lot of areas that are even untouched by any person, and
Very
we
true.
need that gap to be filled.
Be filled, yes.
So was indeed very interesting for people like me that want to explore
The
I don't
world
want
of
to,
entrepreneurship.
yes, I don't want to like minimize my thinking to only one thing. Like now I'm a public servant. No, I want to become a politician and I'm an entrepreneur. So I like a lot of discussions different from,
Surrounding that, yes. So,
yeah,
what's the
different from,
thing in the discussion in this particular one? Like, can you just pick it out for us? The point that you said, this will change the way I practice. You told us about the keynote speaker creating more awareness. So, will that make you educate your patients more on optometry or encouraging their children or younger ones to study optometry? Is that how it'll make you change your practice, or is there anything else?
because of lack of awareness. When you come to the clinic, many people see us just as people that just measure glasses and dispense. So for me to create awareness is to change the modality of how I see my patient. Even if a patient will have to see an ophthalmologist first before he comes to me, so I will find a way to take care of the patient, care that the patient will feel that this one too is giving me a professional service. So by that, the patient would like to know, what have you done? What is your profession? Yeah, of course, by
Okay,
how
so
I
now let's
practice.
dive deeper into innovations, new research, or clinical pearls. Did anything change your perspective on diagnosis or treatment or patient education? Apart from this, something a bit more clinical?
Yeah, actually, in the panel discussion, uh, uh, they said that there is a lot of uh, things coming up, new technologies, the AI now that
Yes,
is coming up. So as practitioners, we don't have to delve ourselves in the olden day practice. We need to improve, we need to upgrade, we need to learn, and we need to embrace this AI, that the artificial intelligence that
intelligence, yeah.
comes into the AI, that comes into the eye care, so
Okay.
that we move forward because the whole world is technologically driven. You can't progress when you are still thinking of how our forefathers do it. So
Very true. So, there are some optometrists that are still a bit traditional. They prefer to work with their retinoscope to see all the patients and their loose trial lens box. We're not saying that is outdated or it should be thrown away. There are cases when you really need to just carry your ret and scope to get the hang of the problem. But imagine running your whole clinic that has a constant inflow of patients with just
mm,
a retinoscope, an ophthalmoscope, and a trial lens kit in the
that
21st century, in 2025.
that means you'll miss a lot actually because
Exactly.
with the current technology that we have the retinal scans, retinal scanners. We have the imaging, uh, this thing, retinal imaging, fundus
Yes, yes.
photography.
A fundus camera that you can actually get high definition
Fundus,
pictures instead of seeing it in the ophthalmoscope. Like, you can compare, you can discuss with your colleagues or
yes,
anybody you're referring to.
with the coming up of the OCT machine, that is optical coherence tomography, actually, I would say that your clinic or your patient will move a lot. Of course, well, imagine you just using just retinoscopy, your trial lens box to run a clinic. So how will you detect retinal problems when you don't even
You
have
don't
a good
even have
amount of
the exactly the equipment to
so
do that.
so that means you are still an eye doctor, but you are like an
It
outdated or semi-outdated eye doctor.
Yes, it's
So
just like cooking with firewood in this modern times that we already have digital tabletop cookers that you can just press with a button and it'll get hot
So
and you'll fry your eggs or make your stew.
so you see, but the thing is that it's a two-way problem.
Okay.
When you want to upgrade, at the same time the economy is hitting hard.
Oh, that's true. That's true.
So imagine the price of a Kunduz camera now. The list will be like a minimum of 10 million naira. So imagine as a young graduate, for example, or a young optometrist that is trying to, that is just for one equipment. So think of the OCT that is 70 million naira. What of the fundus scanners that is over 100 million naira? So there is need for the government to come into this so that the patient will benefit, because we can't stock ourselves in the olden days practice. And also at this point, I want to say this. Actually, we are stocking ourselves to only opening of eye clinic. Everybody that comes out, we just want to open an eye clinic. But at that, even I like reading, so and research. I know some of the things that was said, but at that time, it was confirmed to me because people that are experienced in the field have said it. We don't have, everybody must not go and open an eye clinic. You can open an eye diagnostic center, be doing CBF, be doing OCT. So you don't need to all those burden of patients coming in. You didn't call the patient, his next appointment, all those things. And also there's an area that we are not even touching. Where is the area of how can we manufacture the frames that our patients are using? We are importing them. What of the lenses? Up till now, we are not producing it. So all these areas are areas we need investment. We need investment in that areas. So actually our eyes are open now. We know that there is a lot of areas to invest, and you can get your money. All these people.
Were there any discussions on hot topics like myopia control or dry eye or public health strategies that stood out for you in the summit?
Yes. As my colleague Dr. Abdurrahman Barnawa just talked about high topics, I think he has said it all. The only thing I will add is some of the advancements that were discussed in the summit are not only limited to entrepreneurship and all, but clinically things like virtual reality in optometry, teleoptometry, that is telemedicine in eye care, and all these automated systems or artificial intelligence in
Yes.
optometry were discussed. Exactly, like when we are discussing about teleoptometry, post-COVID pandemic, during COVID, an opportunity was created, a unique opportunity to advance health into like a telehealth across several medical fields, and optometry is no exception. And the widespread emergence of this teleoptometry has actually given access to individuals around the globe to get access to eye care, like to provide a feasible solution for triage, screening, consultations, and even remote supervisions, especially with patients like, let's say, patients with diabetic retinopathy. So the growth of teleoptometry, even though it has been there for quite some time now, for some years, but
But
it
it's
ensures
relatively
continuity
new
of
in
care.
Nigeria.
Yes, Yes, especially for vulnerable populations such as individuals with disabilities and those that cannot actually access the eye care, those in remote areas and all. That is like those living in medically underserved areas.
Yes.
It
But
reduces effectively travel time and cost,
but how do
and
they
also
access
break.
that? People in underserved areas, people in areas where eye care is inaccessible. Let's say the very rural
Yes,
areas. How can they take advantage of
yes.
telehealth?
Okay. What they were discussing was training, first of all, personnel that are grounded in those areas, like rural areas.
Okay.
As we were saying, some were suggesting training like the community health extension
They're the
workers.
best people to train,
In,
yes. Since
yes,
there's a
in
background.
actually guiding, yes,
Mm,
because they are the ones that are found in all those remote areas, so as to give the necessary uh, help to the people in need there.
okay.
And also, when we look at artificial intelligence per se in optometry, for the past decade alone, applications of artificial intelligence and deep learning in optometry have expanded considerably with disease screening management, all this. I don't know if you have heard of any application called iArt, like an
Mm,
AI,
okay.
which I think have now gotten or received approval from the United States Food and Drug Administration to be used in diabetic retinopathy screenings.
That's
So
actually
with
interesting.
applications,
Like
yes,
that,
with
yes.
applications, exactly. With applications like that in complex retinal image analysis, algorithms or data can be presented, and also the AI can compute the data in management of several eye diseases, glaucoma, keratoconus, cataract. For example, let's say optometry and ophthalmology rely heavily on high resolution images captured in patients or functional information to guide clinical decisions. However, interpreting this data is quite bulky
Yes.
because the data is too much, ahem,
And
can be
hectic. So
sometimes
it does it
challenging.
for you. Yes.
Exactly. An AI system can be trained to extract and classify these data so as
Definitely.
to, reduce diagnostic errors and improve treatment of ocular conditions.
That's actually very
And also,
interesting.
yes, and also, this can help in controlling visual impairments in patients within a primary eye care or community settings, as far as people are trained to use this.
Use it appropriately.
Yes.
So that's
So with this
a
and other things.
relatively unexplored area in Nigeria, if I may say, northern Nigeria especially. And
Yes,
if
in
we can take
Nigeria,
advantage of
initially,
AI, it will go a long way in
yes,
making eye care accessible and available to even the underserved
exactly,
areas, if I got you right.
exactly,
Yes.
exactly. So the thing we are all complaining about, shortage of optometry, shortage of this, the clinics are all within the metropolis of each state and all. We can actually go beyond that in
Yeah.
telemedicine, teleoptometry, and also artificial intelligence and deep learning.
This is such an insightful point that you just raised. Thank you, Dr. Kabir
Yes.
Labaran. Welcome on board. Please, can you give us a quick introduction and tell us your role in eye care and what excited you about the Eyeball Summit?
Okay, good evening, everyone. So, I am Dr. Kabir Labaran Ubali, an optometrist and also a lecturer at Federal Polytechnic Kabo, or pardon me, Federal University of Science and Technology Kabo.
Oh, yeah.
Uh,
And a
yes.
returning guest on the Happy Eyes Pod show. Make sure you say that fast.
Yeah, exactly. Returning guest of Happy Eye podcast. So, what excited me about the just recently concluded Eyeball Summit was how the event uh, collaborate so many eye care professionals. In fact, all the eye care professionals, the ophthalmologists, optometrists, opticians, ophthalmic nurses. Apart from eye care professionals, there are leaders in eye and other, training institutions, leaders, hospital leaders, and also the business people actually. So what excited me is, finding these people all in one place. So from that, I know this event, nobody will want to miss such type of events because of the type of knowledge and experience we are going to gather in such type of events, which we actually do. We have learned a lot.
Okay,
So that's
interesting.
what excited me.
Dr. Ahmed, can you give us a quick intro? Tell us your name, your role in eye care, and what excited you most about attending the Eyeball Summit.
Good evening, all. As the host said, I am Dr. Ahmed Adam Muhammad, a clinician as well as an academician. So, to hit the nail on the head, what excited me most at the Eyeball Summit, I can fragment them into like three. The first one was how different eye care practitioners as well as other practitioners came and united themselves in the name of strategizing for achieving meaningful thing in the eye care. First, the ophthalmologists and optometrists, ophthalmic nurses and opticians knew like the problems in the eye system, and they also knew how to solve them. Inshallah, God willing, all what was said will be mount. And as you know, summit is not as big as a conference. A conference is where many researchers will come and digest what they.
Can you quickly tell us, Dr. Kabir Labaran, any session or any speaker that really stood out to you and why?
So actually, most of the speakers stood out.
Okay, your favorite, the best.
The best actually is the Vice Chancellor of Imo State University, because actually, he is a great leader leading the whole, and also that university has been graduating the optometrists for many years, and what he shared to us was really interesting. In fact, he's not an optometrist, but he shared so many things that will help us to move our profession forward. Sometimes you need to hear the opinion of other people, how they see you. You would have an idea on the perception of public on your profession. So actually, he shared so many interesting things. Like Dr. Abraman said, there was a time that he was telling his students to apply for optometry because he knows what optometry is all about among his, his community, people to apply for such profession because we are lacking manpower, and he knows the significance of
Yes.
so he realized so many things like there is lack of awareness among people because he has been trying a lot, but people still sometimes didn't go for the optometry profession. What they know is nursing, MBBS, and other allied
Popular health courses, yes.
Yes, so he has been trying so much to do that, which is our job, which is our responsibility. So that thing he shared to us really tell us that we need to do, we need to work very hard on making, creating awareness among communities, especially here in the north. That only one university that has started this program. They have been doing it for many years, but still,
True. For
people are not
decades.
aware of of what this profession is all about, and that lack of professionals in that area is affecting us very badly. We lack
Okay.
optometrists in so many places, yes, and there was a statistic of optometrists in Nigeria. I think, if I'm not forgetting, one optometrist is dealing with almost 50,000 people in this community. So you can see the number. Actually, we need people to come inside this profession. We need a lot of professionals in the eye care. There is high prevalence of eye problem that could lead to blindness. Recently, I've heard that there was a research that was carried out saying that by 2050, half of the world population are going to be myopic. So
Which
think
is
about that.
scary, very scary.
It's scary. Exactly. 2050 is really approaching. So that shows that we need more professionals, we need more optometrists, we need more eye care professionals to serve the community.
Okay, thank you so much for that. Dr. Ahmed, welcome back. You had a network glitch, I suppose. You were telling us what excited you most about the Eyeball Summit.
Okay.
Telling
Did
us
I
that it's a
mention?
bit different from conferences because you don't have
Okay.
researches
Okay.
available and all.
Okay. Yes. As I was talking about, I said a summit is small, not as big as a conference, because usually a problem is like a problem is fish out, I could say, then the justification and how to tackle the problem. And that was exactly what happened in the summit. Professionals and other health workers
Stakeholders.
itemized the main like lack of synergy between the eye care professionals and how to maybe take all the practitioners, the patients, even the policymakers to the promised land. And lastly, my president, Nigerian Optometric Association, Dr. Anderson Chimezire, Dr. Edwin Obinna Auyaka, united and promised us that optometry would be better, because for the past 50 years, optometry has not been on the table for policy making and decision making in Nigeria. But now, due to this maiden Eyeball Summit, so all things will be in order, so that what we are hearing in Canada, America, and United Kingdom
will
will be
happen
what
in Africa, Nigeria, by God's
and
grace.
Nigeria. Thank
Yes.
you.
Okay. So, Dr. Ahmed, can you quickly tell us, just because you went for this Eyeball Summit, what is one thing you'll start doing differently in the clinic while seeing patients? Anything you learned that will make you start doing things differently?
Yes,
Okay.
because there was a lecture that was done by one doctor concerning stress, and I love that lecture because he related the stress with all what we are doing. So, and even when it comes to saving lives, you need to take care of yourself. So I will be
Yes,
more
because
cautious towards my health being.
Okay, so can you just share one tip that he shared for managing stress
Yes, for managing stress
in
is
the clinic?
you need to, like an adage which says that all work and no play makes Jack a dull boy. So
Yes.
even if you are if you are performing work, you need to pause
And take
and
some
just
breaks, which is very